Okay, this is JJ Singh getting back to you about the Health Insurance Act, Health Reform Act. Wanted to share some other thoughts about the policies in the act for protecting the choice to keep current coverage. And a couple of things I wanted to share is that the act has a limitation on any changes in terms or conditions of the insurance company. The issuer, meaning the company, your Aetna, United Healthcare, what have you, the issuer does not change any of its terms and conditions, including benefits and cost sharing, from those in effect as of the day before the first day of Y1, year one, saying you can't, if you have certain terms and conditions and certain cost sharing and certain things in motion and place before this bill would take in effect, you can't just change them once the act is passed. You have to keep the same ones going. Also, there's restrictions on premium increases. The issuer cannot vary the percentage increase in the premium for a risk group of enrollees in specific insurance coverage without changing the premium for all enrollees in the same risk group at the same rate as specified by the commissioner. In layman's terms, like I said earlier, I have a heart condition, and my insurance company, that I have before this bill takes in effect, it can look at my heart and say, I make enough money, my heart issue, look at my wallet, and then look at the fact that I have this heart issue and say, I make enough money that I'm going to get more money from JJ, from me. The bill says you can't do that. The insurance companies cannot single out those that have more money in particular risk groups and raise their premiums because they know because they feel or fear they may lose money from other members of that risk group that are of a lower income. So they have to keep everything the same, or else they have to increase everyone's rates, everyone's premiums in that risk group. Which obviously, if everyone has a increase in premium, then everyone's just going to leave and they'll be worse off. There's also a grace period established. So you want to keep your current coverage. The insurance company says we can't change and we can't raise our standards and we can't do what the government wants us to do. They give them 5 years. They give them 5 years from the beginning, from the first day of Y1, year one, to make those changes. And there's other things too. Guaranteed issue and renewal for insured plans. Like I said a few times before, prohibiting pre-existing condition exclusions. Now I have a lot more to read, but mainly for those of you who are involved in the debate, whether it be going to the town halls, talking with your co-workers, your family, your church members, sitting on the couch watching the TV, watching the news shows, and then screaming and swearing at them like I was. Yeah, it's 237 pages, and there's a lot of jargon, but just reading it, and even what you can grasp and what you can understand, makes you more informed. Now, even if you don't believe anything I said or believe everything I said, it doesn't matter. Read it for yourself. I just need a venue to express, but I think President Obama has a long way to go. So far what I've seen, that things are not laid out the way folks want. There's an issue of whether or not the public insurance company that's created would allow abortions. And I absolutely agree that I don't want any of my money going for abortions. And I haven't read yet whether or not abortions will be still just be an individual thing, because he's pro-choice, whether it's going to be based on what the state state laws are or whatnot. But I agree with that, and I think that's my next task for me to learn about. But in recap, it's not single payer. There are no death panels, just consultations. You absolutely can keep, not only can you keep your current insurance, but the bill is protecting your current insurance the way it is, so they don't make any drastic changes that you may be upset about. And mainly, it's all about raising the standards of all health insurance so that healthcare can be reformed. They talked about a lot about insurance today in the town hall, but it's the core of it is healthcare reform. Still haven't talked about whether or not illegal aliens would have access to this. Absolutely, without paying taxes, without buying into it with your taxes, one should not be allowed to receive these benefits. And I say this as a brother that grew up in LA with plenty of Latin American friends. If you don't pay taxes, because I pay my taxes, I see $200-300 out of my check every 2 weeks. If you don't pay taxes, you don't buy into this, you shouldn't get it. But with all that, I'm going to keep reading, come back to you with some more 411. Again, this has been JJ Singh. Hit me back, respond. I take it all. So, take care.